critical side effects, mental illness being one, surgery backlog being another, and concluded that we needed to do something special to try and pick up and cover some of this lost ground. Because at the end of the day, this is not a statistic. It's really about people. And people are suffering for years in some cases. 3, 4, 5, I've even seen a 6-year wait for a hernia surgery. A hernia surgery could cost you, $300,000 or more. And many Jamaicans just cannot afford it. Because COVID has amplified that challenge, we went up to about 7,000 or 8,000 people waiting, and we picked out the ones that were the longest waits, but also some of the less complicated procedures, because we also appreciated that we wanted to minimize inpatient care. And so to the extent that we could treat with these patients and they have a 1 day, maybe a 2, unless some complications develop, or none at all, day surgeries, then we should try and get those out of the way and outsource those to the private sector. So we have set a target of 2,000 surgeries. We have outsourced 250 in the West, based on the backlog of cases at Cornwall and Hospital and some of the others. We are trying to pull about 200 to 300 here in the Sierra region, which includes Kingston and St. Andrew, St. Catherine, St. Thomas. And we have compiled, I think, up to now about 70 or 75. So we're still going through the files and trying to pull and get persons to come on board. The procedures we identified are those that are most, that populate the wait list: angioplasty, oral cancers, sinus cancers, thyroid cancers, and so on, right? This Code Care program, it's really a relief. It's a give back. It really is a great service to the challenges that we face. We have embarked on a series of public-private partnerships, whether it's diagnostic outsourcing or it is a block of patients that we assign to a private doctor who have chronic ailment. We're piloting that now. Or it is in terms of the drug serve windows that we put in private pharmacies, or in this case now surgeries. So this is not an unusual principle that we're articulating. It's a principle that we have bought into. The reward for this program is to see the relief and the happiness on the face of the patients in their beds who otherwise would not have had it for probably many more years to come. So it's not even a concept around pay for service. It's almost like just helping humanity, if you will. I want us to be patient-centric, focus on the patient, because this is about serving the people. That's what our job is, and whether we're in the private or public sector, it is the core mandate of all of us.